If you have a bad internet connection, it is hard to have a good video call. There are still solutions. So one solution would be that you could resort to text. In limited circumstances, you could resort to a phone call. The limitation really is insurance driven. Not all insurance companies will pay for phone calls. So if your doctor is willing to work with you and see you anyway, I mean, then great, that'd be fantastic, and you have a good doctor if they're willing to do that, but some doctors, no pay, no play. So if your insurance company doesn't cover a phone call, then there's not much recourse that you have. The alternative, however, let's say if you're talking about bad internet connection, like your home wired internet doesn't work, most video conferencing software at this point will still work on a cell signal. So if you can go get a cell signal somewhere, you can still have the call. If you can go find a public Wi-Fi somewhere that works better, you can still have the call. So there are less high-tech solutions that just involve using other communication modalities to try to get the help that you need. And obviously we wouldn't recommend texting if it's a life-threatening emergency, right? That call 911 or your doctor in that case, right? But, so texting, we have secure texting just built into our application, and at this point there are a lot of healthcare providers that do that. Whether they turn it on for patients or not is a different question. But it's entirely feasible, right? So it could be if you have a medical problem, in our case, you can send us a text. Take a picture of it or just type up what it is that's causing the problem for you and send it over, and we can analyze that and get back to you. The hesitancy with text historically has been, one, again, payment related, and I keep coming back to payment in some of these questions because payment dictates much of the action that we see doctors taking or choosing not to take. Texting has not historically been reimbursed. So many doctors looked at that and said, why am I going to spend my time reading the text and replying when I'm not going to be paid for this, right? You need to contact me through some means that is reimbursable to me. Other doctors have taken other types of reimbursement strategies, whether that be cash pay strategies or subscription payment strategies, which in their case says, actually, this is part of the service that I provide, right? So I'm more than happy to take your text because this is how we've arranged the relationship, right? You pay me on a monthly basis or whatever it is to be available to do this. But other than that, it really just comes down to describing your problem in words rather than talking it out and typing it up, and then your doctor may ask you some follow-up questions or more information. It's going to be basically the same idea as if you sat in their office and told them the story. They would ask you some additional questions and you provide some additional info. Then they may ask you to do some testing, right, to try to validate things, or they may ask you to, hey, take a picture of that rash and send it over to me, right, and things like that could go on. But it can actually be very, very effective, particularly for lower level problems, So we always tell patients, if you think this is a critical or life-threatening thing, don't text because of the time constraint, right? The doctor may not see it in a timely manner. They may not be able to get back to you that fast, so call for something like that. If it's a lower level problem or something that you feel is not really an emergency, texting can be good. But don't just start texting your doctor randomly. Clarify with them whether they're willing to accept text from you. But be aware that some people are willing to do that. And there are services now running around that are text-only type medical care. I would put it this way, our feeling about that is that rather than having one type of service to do one type of thing, our feeling is that you're best going to be served by a multifaceted service, meaning probably your own doctor's office, right? If they're available to you by phone and they also could see you on video conference and they also could take your text message and they've also got staff members that could take your call if that was needed, right? And they could see you in the office or they could see you in the hospital. Being able to care from you in all those different ways and having access to the full expanse of whatever your healthcare data is probably the best way to go about doing that, as opposed to sending a text off to somebody that knows nothing about you, they don't know your meds, they don't know your health history, etc. Right. So again, you can use whatever it is that works for you, but just kind of be aware of those backing issues with any of this stuff. In general, we tend to favor what I would describe as a hybrid model, meaning a combination of virtual and in-person availability on some level. And the reason for that is because in certain instances, the list of things for which you need in-person care is shrinking, but there are still instances in which you need in-person care. If there's continuity between those actors, the virtual actors and the in-person actors, that's better for you. If there's continuity, particularly of your health data, and this is a shout out to all the people that do EMRs and health data, it's a huge problem across the country. But if all your health data has continuity between all these people, that's a big benefit for you, right? So they don't have to be confused about what's going on or reinvent the wheel. But in summary, can you text your doctor? Yes. Can it be effective? Yes. Just bear in mind the caveats.